NCLEX-RN Challenge Exam Questions Part 2. Question 1. Which of the following facts about claudication is correct? Select all that apply. Here are the options. Option A. Oxygen demand is greater than oxygen supply. Option B. Pain often occurs during rest. Option C. It is a result of tissue hypoxia. Option D. It is characterized by cramping and weakness. The correct answer is option A. Oxygen demand is greater than oxygen supply. Claudication is ischemia-related pain cramping/weakness that occurs when the muscle's oxygen demand exceeds the available supply. Question 2. Which instruction should be included for a patient with peripheral vascular disease (PVD)? Here are the options. Option A. Walk barefoot whenever possible. Option B. Use a heating pad to keep feet warm. Option C. Avoid crossing the legs. Option D. Use antibacterial ointment to treat skin lesions. The correct answer is option C. Avoid crossing the legs. Crossing the legs compresses vessels and can further impair already compromised circulation in a patient with PVD. Question 3. A patient diagnosed with Raynaud's disease vasospastic disorder is most likely to fit which description? Here are the options. Option A. An adolescent male. Option B. An elderly woman. Option C. A young woman. Option D. An elderly man. The correct answer is option C. A young woman. Raynaud's disease predominantly affects young women, typically between the ages of 15 and 30. Question 4. A pregnant patient on bed rest for 6 days has sudden shortness of breath and chest pain. What is the most likely cause? Here are the options. Option A. Myocardial infarction. Option B. Pulmonary embolism due to DVT. Option C. Anxiety attacks. Option D. Congestive heart failure. The correct answer is option B. Pulmonary embolism due to DVT. Pregnancy and prolonged mobility are major risk factors for DVT, which can lead to a life-threatening pulmonary embolism. Question 5. What is a significant and dangerous complication associated with thrombolytic therapy used in stroke treatment? Here are the options. Option A. Air embolism. Option B. Cerebral hemorrhage. Option C. Expansion of the clot. Option D. Resolution of the clot. The correct answer is option B. Cerebral hemorrhage. The primary risk of thrombolytic therapy is major bleeding, most dangerously a cerebral hemorrhage. Question 6. An infant holds his head in an unusual position and always faces to one side. What is the most likely explanation? Here are the options. Option A. Torticollis. Option B. Craniosynostosis. Option C. Plagiosophy. Option D. Hydrocephalus. The correct answer is option A. Torticollis. Torticollis rhinic is caused by the shortening or contraction of the sternocleidomastoid muscle, causing the head to tilt. Question 7. Which statement about Osgood-Schlatter disease is correct? Here are the options. Option A. Caused by competitive swimming. Option B. Usually requires surgical intervention. Option C. Patient experiences pain in the inferior aspect of the knee. Option D. Student is trying to avoid physical education. The correct answer is option C. Patient experiences pain in the inferior aspect of the knee. Ausgeschlatter is an overuse injury causing pain and swelling at the tibial tubercle, just below the knee cap. Question 8. A nurse asks a 13-year-old female to bend forward at the waist with arms hanging freely. Which assessment is being conducted? Here are the options. Option A. Spinal flexibility. Option B. Leg length disparity. Option C. Hypostatic blood pressure. Option D. Scoliosis. The correct answer is option D. Scoliosis. The Adams forward bend test is the standard screening tool used to detect the spinal curvature or rib hump associated with scoliosis. Question 9. Which characteristic is the nurse least likely to find in a parent who is abusing their child? Here are the options. Option A. Low self-esteem. Option B. Unemployment. Option C. Self-blame for the injury. Option D. Single status. The correct answer is option C. Self-blame for the injury. Abusing parents often use denial or project blame onto the child. They rarely exhibit genuine self-blame or insight into the injury. Question 10. Which sign or symptom in a 4-year-old child following head trauma would be a cause for concern regarding increased ICP? Here are the options. Option A. Bulging anterior fontanel. Option B. Repeated vomiting. Option C. Signs of sleepiness at 10 p.m. Option D. Inability to read short words from 18 inches. The correct answer is option B. Repeated vomiting. In a 4-year-old whose fontanelles are closed, repeated vomiting is a classic sign of increased intracranial pressure. Question 11. Which observation indicates that a non-immunized child may have rubeola measles? Here are the options. Option A. Small blue-white spots visible on the oral mucosa. Option B. The rash begins on the trunk and spreads outward. Option C. There is low-grade fever. Option D. Lesions have a teardrop on a rose petal appearance. The correct answer is option A. Small blue-white spots visible on the oral mucosa. Complex spots, small blue-white spots on the inner cheeks are a pathognomonic early sign of rubeola. Question 12. Which description of scarlet fever is not correct? Here are the options. Option A. Caused by group of streptococcus. Option B. Strawberry tongue is a characteristic sign. Option C. Petechia occur on the soft palate. Option D. The pharynx is red and swollen. The correct answer is option C. Petechia occur on the soft palate. While strep can cause petechia, they are not a defining characteristic of scarlet fever as much as the sandpaper rash and strawberry tongue are. Question 13. A 30 kg child is prescribed Benadryl 25 mg 3x/day. The correct dose is 5 mg/kg/day. Which describes this dose? Here are the options. Option A. It is the correct dose. Option B. The dose is too low. Option C. The dose is too high. Option D. The dose should be increased or decreased depending on symptoms. The correct answer is option B. The dose is too low. Calculation: 30 kg * 5 mg equals 150 mg/day. The current order 25 mg * 3 is 75 mg/day, which is half of the recommended dose. Question 14. Regarding an undescended testes in a 2-month-old, which statement is most accurate? Here are the options. Option A. Normally the testes are descended by birth. Option B. The infant will likely require surgical intervention. Option C. The infant probably has only one testes. Option D. Normally the testes descend by 1 year of age. The correct answer is option A. Normally the testes are descended by birth. In most full-term infants, the testes have already descended into the scrotal sac by the time of birth. Question 15. Nurse Jenny is instilling an otic solution into an adult male client's left ear. Nurse Jenny avoids doing which of the following as part of the procedure? Here are the options. Option A. Pulling the auricle backward and upward. Option B. Warming the solution to room temperature. Option C. Placing the tip of the dropper on the edge of the ear canal. Option D. Placing the client in a side-lying position. The correct answer is option C. Placing the tip of the dropper on the edge of the ear canal. The nurse should avoid touching the ear canal with the dropper tip to prevent contamination of the medication bottle. Question 16. Nurse B should instruct the male client with an ileostomy to report which of the following symptoms? Here are the options. Option A. Absence of drainage from the ileostomy for 6 or more hours. Option B. Passage of liquid stool in the stoma. Option C. Occasional presence of undigested food. Option D. A temperature of 37.6 degrees C. The correct answer is option A. Absence of drainage from the ileostomy for 6 or more hours. Absence of drainage for 6 or more hours in an ileostomy is a sign of a potential bowel obstruction and must be reported immediately. Question 17. Jerry has been diagnosed with appendicitis. He develops a fever, hypotension, and tachycardia. The nurse suspects which of the following complications? Here are the options. Option A. Intestinal obstruction. Option B. Peritonitis. Option C. Bowel ischemia. Option D. Deficient fluid volume. The correct answer is option B. Peritonitis. Fever, hypotension, and tachycardia in a patient with appendicitis are classic signs of peritonitis following a ruptured appendix. Question 18. Which of the following complications should the nurse carefully monitor a client with acute pancreatitis? Here are the options. Option A. Myocardial infarction. Option B. Cirrhosis. Option C. Peptic ulcer. Option D. Pneumonia. The correct answer is option D. Pneumonia. Acute pancreatitis can cause respiratory complications such as pleural effusion, atelectoses, and pneumonia due to inflammatory mediators. Question 19. Which of the following symptoms during the icteric phase of viral hepatitis should the nurse expect the client to inhibit? Here are the options. Option A. Watery stool. Option B. Yellow sclea. Option C. tarry stool. Option D, shortness of breath. The correct answer is option B, yellow sclea. The icteric phase is characterized by the onset of jaundice, which is most easily observed as yellowing of the sclea. Question 20. Marco, who was diagnosed with a brain tumor, was scheduled for craniotomy. In preventing the development of cerebral edema after surgery, the nurse should expect the use of. Here are the options. Option A, diuretics. Option B, antihypertensive. Option C, steroids. Option D, anticonvulsants. The correct answer is option C, steroids. Dexamethasone, a steroid, is commonly used post-craniotomy to reduce inflammation and prevent cerebral edema. Question 21. Halfway through the administration of blood, the female client complains of lumbar pain. After stopping the infusion, Nurse Hazel should. Here are the options. Option A, increase the flow of normal saline. Option B, assess the pain further. Option C, notify the blood bank. Option D, obtain vital signs. The correct answer is option A, increase the flow of normal saline. After stopping a transfusion for a suspected reaction, the nurse must keep the Roman IV line open with normal saline to maintain access for emergency meds. Question 22. Nurse Maureen knows that the positive diagnosis of HIV infection is made based on which of the following? Here are the options. Option A, a history of high-risk sexual behaviors. Option B, positive ELISA and Western blot tests. Option C, identification of an associated opportunistic infection. Option D, evidence of extreme weight loss and high fever. The correct answer is option B, positive ELISA and Western blot tests. A positive ELISA followed by a confirmatory Western blot test is the standard diagnostic protocol for HIV. Question 23. A client with chronic renal failure recognizes an adequate amount of high biological value protein when they select. Here are the options. Option A, raw carrots. Option B, apple juice. Option C, whole wheat bread. Option D, cottage cheese. The correct answer is option D, cottage cheese. High biological value proteins contain all essential amino acids. Dairy products like cottage cheese are excellent sources for CRF patients. Question 24. Kenneth, who is diagnosed with uremic syndrome, has the potential to develop complications. Which among the following should the nurse anticipate? Here are the options. Option A, flapping hand tremors. Option B, an elevated hematocrit level. Option C, hypotension. Option D, hypokalemia. The correct answer is option A, flapping hand tremors. Asterixis flapping hand tremors is a common neurological finding in patients with uremic syndrome or hepatic encephalopathy. Question 25. A client is admitted to the hospital with benign prostatic hyperplasia. The nurse's most relevant assessment would be. Here are the options. Option A, flank pain radiating in the groin. Option B, distension of the lower abdomen. Option C, perineal edema. Option D, urethral, 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 The correct answer is option B. Distension of the lower abdomen. BPH causes urinary retention, which leads to a distended bladder that can be palpated in the lower abdomen. Question 26. A client has undergone a penile implant. After 24 HRS, the client's scrotum was edematous and painful. The nurse should, here are the options. Option A. Assist the client with sitz bath. Option B. Apply warm soaks in the scrotum. Option C. Elevate the scrotum using a soft support. Option D. Prepare for a possible incision and drainage. The correct answer is option C. Elevate the scrotum using a soft support. Elevation of the scrotum reduces edema and provides comfort following genital or pelvic surgery. Question 27. Nurse Hazel receives emergency results for a client with chest pain. An increased myoglobin level suggests. Here are the options. Option A. Liver disease. Option B. Myocardial damage. Option C. Hypertension. Option D. Cancer. The correct answer is option B. Myocardial damage. Myoglobin is one of the first markers to rise following myocardial damage, though it is not as specific as troponin. Question 28. Nurse Maureen would expect a client with mitral stenosis to demonstrate symptoms associated with congestion in the. Here are the options. Option A. Right atrium. Option B. Superior vena cava. Option C. Aorta. Option D. Pulmonary system. The correct answer is option D. Pulmonary system. Mitral stenosis causes blood to back up into the left atrium and subsequently into the pulmonary veins and lungs. Question 29. A client has been diagnosed with hypertension. The nurse's priority nursing diagnosis would be. Here are the options. Option A. Ineffective health maintenance. Option B. Impaired skin integrity. Option C. Deficient fluid volume. Option D. Pain. The correct answer is option A. Ineffective health maintenance. Hypertension is often asymptomatic, and the biggest challenge is ensuring the patient maintains their treatment and lifestyle changes. Question 30. Nurse Hazel teaches the client with angina about common expected side effects of nitroglycerin, including. Here are the options. Option A. High blood pressure. Option B. Stomach cramps. Option C. Headache. Option D. Shortness of breath. The correct answer is option C. Headache. Nitroglycerin causes systemic vasodilation, which frequently results in a throbbing headache as a side effect. Question 31. Which of the following is a risk factor for the development of atherosclerosis and PVD? Here are the options. Option A. High levels of low-density lipid LDL cholesterol. Option B. High levels of high-density lipid HDL cholesterol. Option C. Low concentration triglycerides. Option D. Low levels of LDL cholesterol. The correct answer is option A. High levels of low-density lipid LDL cholesterol. Elevated LDL, the bad cholesterol, is a major contributor to the formation of plaque in the arteries. Question 32. Which of the following represents a significant risk immediately after surgery for repair of aortic aneurysm? Here are the options. Option A. Potential wound infection. Option B. Potential ineffective coping. Option C. Potential electrolyte imbalance. Option D. Potential alteration in renal perfusion. The correct answer is option D. Potential alteration in renal perfusion. Surgical repair of an aortic aneurysm involves cross-clamping the aorta, which carries a significant risk of impaired blood flow to the kidneys. Question 33. Nurse Josie should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12? Here are the options. Option A. Dairy products. Option B. Vegetables. Option C. Grains. Option D. Broccoli. The correct answer is option A. Dairy products. Vitamin B12 is found naturally in animal products, including meat, eggs, and dairy. It is absent in plant foods. Question 34. Karen has been diagnosed with aplastic anemia. The nurse monitors for changes in which of the following? Here are the options. Option A. Bowel function. Option B. Peripheral sensation. Option C. Bleeding tendencies. Option D. Intake and output. The correct answer is option C. Bleeding tendencies. Aplastic anemia involves pancytopenia. A low platelet count thrombocytopenia leads to significant bleeding tendencies. Question 35. Lydia is scheduled for elective splenectomy. Before the client goes to surgery, the nurse in charge's final assessment would be. Here are the options. Option A. Signed consent. Option B. Vital signs. Option C. Name band. Option D. Empty bladder. The correct answer is option B. Vital signs. A final set of vital signs provides the baseline for the surgical team and ensures the patient is stable enough to proceed. Question 36. What is the peak age range for acquiring acute lymphocytic leukemia, ALL? Here are the options. Option A. 4 to 12 years. Option B. 20 to 30 years. Option C. 40 to 50 years. Option D. 60 to 70 years. The correct answer is option A. 4 to 12 years. ALL is the most common childhood malignancy, with a peak incidence occurring between the ages of 4 and 12 years. Question 37. Marie with ALL suffers from nausea and headache. These clinical manifestations may indicate. Here are the options. Option A. Effects of radiation. Option B. Chemotherapy side effects. Option C. Meningeal irritation. Option D. Gastric distension. The correct answer is option C. Meningeal irritation. In ALL, leukemic cells can cross the blood-brain barrier, leading to meningeal irritation and increased intracranial pressure. Question 38. Which of the following is contraindicated for a client diagnosed with disseminated intravascular coagulation (DIC)? Here are the options. Option A. Administering heparin. Option B. Administering Coumadin. Option C. Treating the underlying cause. Option D. Replacing depleted blood products. The correct answer is option B. Administering Coumadin. Coumadin is a long-term oral anticoagulant and is not used in the management of acute DAC. It would be inappropriate and potentially dangerous. Question 39. Which finding is the best indication that fluid replacement for the client with hypovolemic shock is adequate? Here are the options. Option A. Urine output greater than 30 ml/hr. Option B. Respiratory rate of 21 breaths/minute. Option C. Diastolic blood pressure greater than 90 mmHg. Option D. Systolic blood pressure greater than 110 mmHg. The correct answer is option A. Urine output greater than 30 ml/hr. Urine output of 30 ml/hr or more is the gold standard indicator of adequate organ perfusion and successful fluid resuscitation. Question 40. Which of the following would the nurse include in a teaching plan as an early manifestation of laryngeal cancer? Here are the options. Option A. Stomatitis. Option B. Airway obstruction. Option C. Hoarseness. Option D. Dysphagia. The correct answer is option C. Hoarseness. Persistent hoarseness is the most common early sign of laryngeal cancer due to the tumor's effect on the vocal cords. Question 41. Immunosuppressive therapy for myasthenia gravis is effective because it. Here are the options. Option A. Promotes the removal of antibodies. Option B. Stimulates acetylcholine production. Option C. Decreases production of autoantibodies. Option D. Inhibits the breakdown of acetylcholine. The correct answer is option C. Decreases production of autoantibodies. MG is an autoimmune disease where antibodies attack acetylcholine receptors. Immunosuppression lowers the count of these autoantibodies. Question 42. A female client is receiving Roman 4 mannitol. An assessment specific to safe administration of this drug is. Here are the options. Option A. Vital signs Q4H. Option B. Weighing daily. Option C. Urine output hourly. Option D. Level of consciousness Q4H. The correct answer is option C. Urine output hourly. Mannitol is an osmotic diuretic. Hourly urine output monitoring is required to ensure the kidneys can handle the fluid shift and prevent heart failure. Question 43. What is the primary advantage of using a pen-like insulin delivery device over traditional syringes? Here are the options. Option A. Accurate dose delivery. Option B. Shorter injection time. Option C. Lower cost. Option D. Use of a smaller gauge needle. The correct answer is option A. Accurate dose delivery. Insulin pens are designed for high precision and dosing, which is their primary clinical advantage over manually drawn syringes. Question 44. To assess for damage to major blood vessels from a fractured tibia, the nurse should monitor for. Here are the options. Option A. Swelling of the left thigh. Option B. Increased skin temperature of the foot. Option C. Prolonged reperfusion of the toes after blanching. Option D. Increased blood pressure. The correct answer is option C. Prolonged reperfusion of the toes after blanching. Capillary refill reperfusion is a direct measure of peripheral arterial blood flow. A delay suggests vascular damage from the fracture. Question 45. A 65-year-old man is admitted for spinal stenosis surgery. He lives alone in a 2-story house. When should the nurse initiate discharge training and planning? Here are the options. Option A, following surgery. Option B, upon admission. Option C, within 48 hours of discharge. Option D, preoperative discussion. The correct answer is option B, upon admission. Discharge planning should begin upon admission or even preoperatively to ensure all home care needs and potential barriers are addressed early. Question 46. A 5-year-old child appears hesitant to play and frequently asks if it is okay to play with certain toys. Which Erikson stage is the child primarily navigating? Here are the options. Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame and doubt. Option D, intimacy versus isolation. The correct answer is option B, initiative versus guilt. Children aged 3 to 6 years are in the initiative versus guilt stage. Excessive hesitation or seeking permission may indicate a struggle with guilt over self-initiated play. Question 47. A 26-month-old toddler is becoming increasingly assertive, wanting to dress themselves, but becomes frustrated and ashamed if they fail. Which Erikson stage is this? Here are the options. Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame and doubt. Option D, intimacy versus isolation. The correct answer is option C, autonomy versus shame and doubt. Toddlers 1-3 years are in the autonomy versus shame and doubt stage, where they strive for independence and self-control. Question 48. A 20-year-old young adult expresses concerns about a recent breakup and feels isolated from peers. Which Erikson stage is the young adult primarily navigating? Here are the options. Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame. Option D, intimacy versus isolation. The correct answer is option D, intimacy versus isolation. Young adults 18-40 years navigate intimacy versus isolation, focusing on forming deeply personal relationships. Question 49. Which of the following vital signs taken during a school health fair appears to be outside the typical range for the respective age group? Here are the options. Option A, 11-year-old athlete, 90 bpm, 22 rpm, 100/70 mmHg. Option B, 13-year-old female, 105 bpm, 22 rpm, 105/50 mmHg. Option C, 5-year-old male, 102 bpm, 24 rpm, 90/65 mmHg. Option D, 6-year-old female, 100 bpm, 26 rpm, 90/70 mmHg. The correct answer is option B, 13-year-old female, 105 bpm, 22 rpm, 105/50 mmHg. For a 13-year-old, a diastolic blood pressure of 50 mmHg is lower than the typical range, especially alongside a slightly elevated heart rate. Question 50. A 38-year-old female struggles with depression and an anxiety disorder. Which of the following medications is most likely prescribed for these conditions? Here are the options. Option A, amitriptyline Elavil. Option B, calcitonin. Option C, pergolide mesylate Permax. Option D, verapamilcalan. The correct answer is option A, amitriptyline Elavil. Amitriptyline is a tricyclic antidepressant TCA commonly used to treat depression and sometimes off-label for anxiety. Question 51. A patient has a history of respiratory infection, Legionnaire's disease, and multiple sclerosis (MIS. For which condition would the nurse question the administration of erythromycin? Here are the options. Option A, recent bacterial respiratory infection. Option B, past episode of Legionnaire's disease. Option C, family history of campylobacteriosis. Option D, long-standing diagnosis of multiple sclerosis. The correct answer is option D, long-standing diagnosis of multiple sclerosis. Erythromycin is an antibiotic used for bacterial infections. It has no therapeutic role in treating multiple sclerosis, which is a neurological autoimmune disease. Question 52. Based on a history of hyperkalemia, which of the following symptoms reported by the patient would the nurse consider unrelated to an acute episode? Here are the options. Option A, decreased HR. Option B, paresthesias. Option C, muscle weakness of the extremities. Option D, migraines. The correct answer is option D, migraines. Hyperkalemia hypotassium affects muscle and cardiac function weakness, bradycardia, paresthesia, but is not a cause of migraines. Question 53. A patient is suspected of having diabetic ketoacidosis (DK). Which of the following symptoms reported by the patient would the nurse consider atypical for this condition? Here are the options. Option A, persistent nausea and vomiting. Option B, an insatiable feeling of thirst polydipsia. Option C, a noticeable increase in weight over a short period. Option D, a distinct fruity odor on the breath. The correct answer is option C, a noticeable increase in weight over a short period. DKA typically causes dehydration and fluid loss, leading to weight loss, not a short-term increase in weight. Question 54. A nurse suspects acute meningitis in a patient. Which of the following symptoms reported by the patient would the nurse consider not expected for this condition? Here are the options. Option A, a sudden increase in appetite. Option B, episodes of vomiting. Option C, high fever and chills. Option D, sensitivity to light photophobia. The correct answer is option A, a sudden increase in appetite. Meningitis typically causes nausea and a lack of appetite anorexia, not an increase in appetite. Question 55. A patient has red, itchy eyes with a yellowish discharge. Which microorganism is most likely responsible for this bacterial conjunctivitis? Here are the options. Option A, Yersinia pestis. Option B, Helicobacter pylori. Option C, Vibrio cholerae. Option D, Haemophilus aegyptius. The correct answer is option D. Haemophilus aegyptius. Haemophilus aegyptius is a common causative agent of acute bacterial conjunctivitis pink eye. Question 56. A patient with a bullseye rash and joint pain has Lyme disease. Which microorganism is responsible? Here are the options. Option A, Borrelia burgdorferi. Option B, Streptococcus pyogenes. Option C, Bacillus anthracis. Option D, Enterococcus faecalis. The correct answer is option A, Borrelia burgdorferi. Lyme disease is caused by the bacterium Borrelia burgdorferi, transmitted through the bite of infected black-legged ticks. Question 57. An 87-year-old female has increased confusion, falls, and mild left hemiparesis. Which test is most likely to be performed? Here are the options. Option A, CBC complete blood count. Option B, ECG electrocardiogram. Option C, thyroid function tests. Option D, CT scan. The correct answer is option D, CT scan. Sudden onset of hemiparesis, weakness on one side, and confusion in the elderly necessitates a CT scan to rule out a stroke or intracranial bleed. Question 58. An 85-year-old male is losing mobility, gaining weight, and runs the heater even on warm days. Which test is most likely to be performed? Here are the options. Option A, CBC complete blood count. Option B, ECG electrocardiogram. Option C, thyroid function tests. Option D, CT scan. The correct answer is option C, thyroid function tests. Weight gain, lethargy, and cold intolerance running the heater are classic symptoms of hypothyroidism, requiring thyroid function testing. Question 59. A 20-year-old college student is found unconscious with a fever and a rash. Which of the following tests is most likely to be performed first? Here are the options. Option A, blood sugar check. Option B, CT scan. Option C, blood cultures. Option D, arterial blood gases. The correct answer is option C, blood cultures. Fever, rash, and altered consciousness in a young adult suggest meningococcemia or meningitis. Blood cultures are a priority for identifying the pathogen. Question 60. Which behavioral characteristic describes the domestic abuser? Here are the options. Option A, alcoholic. Option B, overconfident. Option C, high tolerance for frustrations. Option D, low self-esteem. The correct answer is option D, low self-esteem. Domestic abusers often have low self-esteem and use violence or control to compensate for feelings of inadequacy. Question 61. The nurse is caring for a client with a long leg cast. Which exercise should the nurse recommend for the affected extremity? Here are the options. Option A, isometric. Option B, range of motion. Option C, aerobic. Option D, isotonic. The correct answer is option A, isometric. Isometric exercises contracting muscle without moving the joint help prevent muscle atrophy while the limb is immobilized in a cast. Question 62. A woman in her first pregnancy has multiple sex partners and is unsure of the baby's father. Which intervention is a priority? Here are the options. Option A. Counsel the woman to consent to HIV screening. Option B. Perform tests for sexually transmitted diseases. Option C. Discuss her high risk for cervical cancer. Option D. Refer the client to a family planning clinic. The correct answer is option A. Counsel the woman to consent to HIV screening. While all are important, counseling for HIV screening is a priority to prevent mother-to-child transmission during pregnancy. Question 63. A 16-month-old child clings to the mother and begins to cry when the nurse enters. What is the initial action by the nurse? Here are the options. Option A. Arrange to change client care assignments. Option B. Explain that this behavior is expected. Option C. Discuss the appropriate use of timeout. Option D. Explain that the child needs extra attention. The correct answer is option B. Explain that this behavior is expected. Separation anxiety and fear of strangers are developmentally normal behaviors for a 16-month-old toddler. Question 64. While planning care for a 2-year-old hospitalized child, which situation is most likely to affect the behavior? Here are the options. Option A. Strange bed and surroundings. Option B. Separation from parents. Option C. Presence of other toddlers. Option D. Unfamiliar toys and games. The correct answer is option B. Separation from parents. For a hospitalized toddler, the greatest stressor is typically separation from their primary caregiver's parents. Question 65. While explaining an illness to a 10-year-old, what should the nurse keep in mind about cognitive development? Here are the options. Option A. They make simple associations of ideas. Option B. They are able to think logically in organizing facts. Option C. Interpretation originates from their own perspective. Option D. Conclusions are based on previous experiences. The correct answer is option B. They are able to think logically in organizing facts. According to Piaget, 10-year-olds are in the concrete operational stage and can think logically about concrete facts and events. Question 66. The nurse has just admitted a client with severe depression. From which focus should the nurse identify a priority nursing diagnosis? Here are the options. Option A. Nutrition. Option B. Elimination. Option C. Activity. Option D. Safety. The correct answer is option D. Safety. In severe depression, the risk of self-harm or suicide is the highest priority. Safety must be addressed before other concerns. Question 67. Which playroom activities should the nurse organize for a group of 7-year-old hospitalized children? Here are the options. Option A. Sports and games with rules. Option B. Finger paints and water play. Option C. Dress-up clothes and props. Option D. Chess and television programs. The correct answer is option A. Sports and games with rules. School-aged children 6-12 years enjoy competitive play and games that follow established rules. Question 68. A client is discharged following hospitalization for congestive heart failure. Which rest position is most helpful? Here are the options. Option A, high Fowler's. Option B, supine. Option C, left lateral. Option D, low Fowler's. The correct answer is option A, high Fowler's. High Fowler's sitting upright decreases venous return and eases the work of breathing, which is essential for CHF patients. Question 69. Which assessment parameter indicates that a 10-year-old on the burn unit has adequate fluid replacement? Here are the options. Option A, urinary output of 30 ml per hour. Option B, no complaints of thirst. Option C, increased hematocrit. Option D, good skin turgor around burn. The correct answer is option A, urinary output of 30 ml per hour. Urinary output of 0.5 to 1.0 ml/kg/hr, roughly 30 ml/hr for an average child, is the best indicator of adequate kidney perfusion and fluid resuscitation. Question 70. What is the priority nursing diagnosis for a patient experiencing a migraine headache? Here are the options. Option A, acute pain related to biologic and chemical factors. Option B, anxiety related to change in health status. Option C, hopelessness related to physiological condition. Option D, risk for side effects related to medical therapy. The correct answer is option A, acute pain related to biologic and chemical factors. The hallmark of a migraine is severe, debilitating pain. Addressing acute pain is the immediate priority. Question 71. Which key item should be included in the teaching plan for newly diagnosed migraine headaches? Select all that apply. Here are the options. Option A, avoid foods with tyramine alcohol, aged cheese. Option B, avoid drugs such as Tagamet and nitroglycerin. Option C, abortive therapy is aimed at the aura phase. Option D, medications can cause rebound headaches. The correct answer is option A, avoid foods with tyramine alcohol, aged cheese. Avoiding triggers like tyramine-rich foods is a cornerstone of migraine prevention and management. Question 72. A patient has a seizure. After the seizure, which action can you delegate to the nursing assistant UAP? Here are the options. Option A, document the seizure. Option B, perform neurologic checks. Option C, take the patient's vital signs. Option D, restrain the patient for protection. The correct answer is option C, take the patient's vital signs. Taking vital signs is within the scope of practice for a nursing assistant. Documentation and neurochecks require nursing judgment. Question 73. You are preparing to admit a patient with a seizure disorder. Which action can you delegate to the LPN/LVN? Here are the options. Option A, complete admission assessment. Option B, set up oxygen and suction equipment. Option C, place a padded tongue blade at the bedside. Option D, pad the side rails before the patient arrives. The correct answer is option B, set up oxygen and suction equipment. LPNs can set up standard safety equipment. Padded tongue blades are contraindicated, and admission assessments must be done by an RN. Question 74. A student is teaching about epilepsy prior to discharge. For which statement should you intervene? Here are the options. Option A. You should avoid consumption of all alcohol. Option B. Wear your medical alert bracelet at all times. Option C. Protect your loved one's airway during a seizure. Option D. It's okay to take over-the-counter medications. The correct answer is option D. It's okay to take over-the-counter medications. The nurse must intervene because many OTC medications like cold medicines can lower the seizure threshold or interact with anti-epileptic drugs. Question 75. Which of the following conditions is linked to more than 50% of clients with abdominal aortic aneurysms? Here are the options. Option A. DM. Option B. HPN. Option C. PVD. Option D. Syphilis. The correct answer is option B. HPN. Hypertension (HPN) is the leading cause of abdominal aortic aneurysms as the constant high pressure weakens the arterial wall over time. Question 76. Which of the following sounds is distinctly heard on auscultation over the abdominal region of an abdominal aortic aneurysm client? Here are the options. Option A. Brute. Option B. Crackles. Option C. Dullness. Option D. Friction rubs. The correct answer is option A. Brute. A systolic brute is a vascular sound heard over an aneurysm caused by the turbulent flow of blood through the dilated area. Question 77. Which of the following groups of symptoms indicated a ruptured abdominal aneurysm? Here are the options. Option A. Lower back pain, increased BP, decreased RBC, increased WBC. Option B. Severe lower back pain, decreased BP, decreased RBC, increased WBC. Option C. Severe lower back pain, decreased BP, decreased RBC, decreased WBC. Option D. Intermittent lower back pain, decreased BP, decreased RBC, increased WBC. The correct answer is option B. Severe lower back pain, decreased BP, decreased RBC, increased WBC. A rupture presents with sudden severe pain and signs of hemorrhagic shock, decreased BP, decreased RBC count, and an elevated WBC count due to stress. Question 78. Which of the following complications of an abdominal aortic repair is indicated by detection of a hematoma in the perineal area? Here are the options. Option A. Hernia. Option B. Stage 1 pressure ulcer. Option C. Retroperitoneal rupture at the repair site. Option D. Rapid expansion of the aneurysm. The correct answer is option C. Retroperitoneal rupture at the repair site. A hematoma in the perineum or scrotum or flank ecchymosis suggests that blood is leaking into the retroperitoneal space from the surgical site. Question 79. Which hereditary disease is most closely linked to an aneurysm? Here are the options. Option A. Cystic fibrosis. Option B. Lupus erythematosus. Option C. Marfan's syndrome. Option D. Myocardial infarction. The correct answer is option C. Marfan's syndrome. Marfan's syndrome is a connective tissue disorder that weakens the structural integrity of the aorta, significantly increasing the risk of aneurysms. Question 80. Which of the following treatments is the definitive one for a ruptured aneurysm? Here are the options. Option A. Antihypertensive medication administration. Option B. Aortogram. Option C. Beta-adrenergic blocker administration. Option D. Surgical intervention. The correct answer is option D. Surgical intervention. A ruptured aneurysm is a life-threatening emergency. Immediate surgical repair is the only definitive treatment to stop hemorrhage. Question 81. Which of the following heart muscle diseases is unrelated to other cardiovascular diseases? Here are the options. Option A. Cardiomyopathy. Option B. Coronary artery disease. Option C. Myocardial infarction. Option D. Pericardial effusion. The correct answer is option A. Cardiomyopathy. Cardiomyopathy is a primary disease of the heart muscle itself and is often not a result of other conditions like CAD or MI. Question 82. Which of the following types of cardiomyopathy can be associated with childbirth? Here are the options. Option A. Dilated. Option B. Hypertrophic. Option C. Myocarditis. Option D. Restrictive. The correct answer is option A. Dilated. Peripartum cardiomyopathy is a form of dilated cardiomyopathy that occurs in late pregnancy or the first few months following delivery. Question 83. Septal involvement occurs in which type of cardiomyopathy? Here are the options. Option A. Congestive. Option B. Dilated. Option C. Hypertrophic. Option D. Restrictive. The correct answer is option C. Hypertrophic. Hypertrophic cardiomyopathy often involves asymmetric septal hypertrophy, which can lead to left ventricular outflow tract obstruction. Question 84. Which of the following recurring conditions commonly occurs in clients with cardiomyopathy? Here are the options. Option A. Heart failure. Option B. DM. Option C. MI. Option D. Pericardial effusion. The correct answer is option A. Heart failure. Structural changes in the heart muscle, regardless of the type of cardiomyopathy, eventually lead to the heart's inability to pump effectively, resulting in heart failure. Question 85. What is the term used to describe an enlargement of the heart muscle? Here are the options. Option A. Cardiomegaly. Option B. Cardiomyopathy. Option C. Myocarditis. Option D. Pericarditis. The correct answer is option A. Cardiomegaly. Cardiomegaly literally translates to enlargement of the heart. Question 86. Dyspnea, cough, expectoration, weakness, and edema are classic signs and symptoms of which of the following conditions? Here are the options. Option A. Pericarditis. Option B. Hypertension. Option C. Obliterative. Option D. Restrictive. The correct answer is option D. Restrictive. Restrictive cardiomyopathy presents with symptoms of congestive heart failure due to the heart's inability to fill properly during diastole. Question 87. Which of the following types of cardiomyopathy does not affect cardiac output? Here are the options. Option A. Dilated. Option B. Hypertrophic. Option C. Restrictive. Option D. Obliterative. The correct answer is option B. Hypertrophic. In the early stages of hypertrophic cardiomyopathy, cardiac output is often maintained, though it may be compromised later if an obstruction develops. Question 88. Which of the following cardiac conditions does the fourth heart sound S4 indicate? Here are the options. Option A. Dilated aorta. Option B. Normally functioning heart. Option C. Decreased myocardial contractility. Option D. Failure of the ventricle to eject all blood. The correct answer is option C. Decreased myocardial contractility. An S4 sound atrial gallop is produced when the atrium contracts against a stiff, non-compliant ventricle, often seen with decreased myocardial contractility. Question 89. Which of the following classes of drugs is widely used in the treatment of cardiomyopathy? Here are the options. Option A. Antihypertensive. Option B. Beta-adrenergic blockers. Option C. Calcium channel blockers. Option D. Nitrates. The correct answer is option B. Beta-adrenergic blockers. Beta blockers are used to decrease heart rate and oxygen demand, allowing for better ventricular filling and reducing symptoms. Question 90. A 23-year-old client has substernal chest pain and a heart rate of 136. Breath sounds are clear. Which drug should the nurse question the client about using? Here are the options. Option A. Barbiturates. Option B. Opioids. Option C. Cocaine. Option D. Benzodiazepines. The correct answer is option C. Cocaine. Cocaine is a potent sympathomimetic that causes rapid tachycardia, vasoconstriction, and myocardial ischemia, leading to substernal chest pain. Question 91. Which assessment finding would strongly suggest that a painless breast lump is cancerous? Here are the options. Option A. Eversion of the right nipple and mobile mass. Option B. Non-mobile mass with irregular edges. Option C. Mobile mass that is soft and easily delineated. Option D. Non-palpable right axillary lymph nodes. The correct answer is option B. Non-mobile mass with irregular edges. Malignant masses are typically hard, fixed to surrounding tissue non-mobile, and have poorly defined or irregular borders. Question 92. A 35-year-old client with vaginal cancer asks about the usual treatment. Which treatment should the nurse name? Here are the options. Option A. Surgery. Option B. Chemotherapy. Option C. Radiation. Option D. Immunotherapy. The correct answer is option C. Radiation. External beam or internal brachytherapy radiation is the most common primary treatment for vaginal cancer. Question 93. A biopsy report classifies a lesion as TIS, ENCO, M. What does this classification mean? Here are the options. Option A. No evidence of primary tumor or metastases. Option B. Carcinoma in situ, no abnormal regional lymph nodes, and no distant metastases. Option C. Can't assess tumor or nodes. Option D. Carcinoma in situ with ascending degrees of distant metastases. The correct answer is option B. Carcinoma in situ, no abnormal regional lymph nodes, and no distant metastases. TIS stands for tumor in situ surface layer only, N0 means no lymph node involvement, and M0 means no distant metastases. Question 94. When teaching a client how to care for a neck stoma after a laryngectomy, which instruction should be included? Here are the options. Option A. Keep the stoma uncovered. Option B. Keep the stoma dry. Option C. Family must perform all care. Option D. Keep the stoma moist. The correct answer is option D. Keep the stoma moist. Maintaining moisture in the stoma is essential for wound healing and prevents the drying of secretions that can lead to airway obstruction. Question 95. Which type of cancer causes the most deaths in women? Here are the options. Option A. Breast cancer. Option B. Lung cancer. Option C. Brain cancer. Option D. Colon and rectal cancer. The correct answer is option B. Lung cancer. While breast cancer is more common, lung cancer remains the leading cause of cancer-related mortality in women. Question 96. Antonio with lung cancer develops Horner's syndrome. When assessing for symptoms, the nurse should note, here are the options. Option A. Meiosis, partial eyelid ptosis, and anhidrosis on the affected side. Option B. Chest pain, dyspnea, and cough. Option C. Arm and shoulder pain with atrophy. Option D. Hoarseness and dysphagia. The correct answer is option A. Meiosis, partial eyelid ptosis, and anhidrosis on the affected side. Horner's syndrome is a triad of symptoms: drooping eyelid ptosis, constricted pupil meiosis, and lack of sweating anhidrosis caused by nerve interference. Question 97. Vic asks the nurse what PSA is. The nurse should reply that it stands for. Here are the options. Option A. Prostate-specific antigen, which is used to screen for prostate cancer. Option B. Protein serum antigen. Option C. Pneumococcal strep antigen. Option D. Papanicolau-specific antigen. The correct answer is option A. Prostate-specific antigen, which is used to screen for prostate cancer. PSA is a protein produced by the prostate gland. Elevated levels can indicate inflammation, benign enlargement, or prostate cancer. Question 98. What is the most important postoperative instruction after a subarachnoid block spinal anesthesia? Here are the options. Option A. Avoid drinking liquids until the gag reflex returns. Option B. Avoid eating milk products for 24 hours. Option C. Notify a nurse if you experience blood in your urine. Option D. Remain supine for the time specified by the physician. The correct answer is option D. Remain supine for the time specified by the physician. Remaining supine flat prevents the loss of cerebrospinal fluid through the puncture site, which helps prevent a postspinal headache. Question 99. A male client suspected of having colorectal cancer will require which diagnostic study to confirm the diagnosis? Here are the options. Option A, stool hematist. Option B, carcinoembryonic antigen CEA. Option C, sigmoidoscopy. Option D, abdominal computed tomography CT scan. The correct answer is option C, sigmoidoscopy. Direct visualization via sigmoidoscopy or colonoscopy allows for a tissue biopsy, which is the only way to definitively confirm cancer. Question 100. Which finding most strongly suggests that a woman has breast cancer? Here are the options. Option A, slight asymmetry of the breasts. Option B, a fixed nodular mass with dimpling of the overlying skin. Option C, bloody discharge from the nipple. Option D, multiple firm, round, freely movable masses. The correct answer is option B, a fixed nodular mass with dimpling of the overlying skin. Skin dimpling resembling an orange peel and a fixed, immovable mass are characteristic indicators of invasive breast cancer. Question 101. A client with cancer is being evaluated for possible metastases. Which of the following is one of the most common metastases sites? Here are the options. Option A, liver. Option B, colon. Option C, reproductive tract. Option D, white blood cells WBCS. The correct answer is option A, liver. The liver is a primary site for metastases for many cancers because of its large size and rich, double blood supply. Question 102. During an MRI scan to rule out a spinal cord lesion, which of the following would pose a threat to the client? Here are the options. Option A, the client lies still. Option B, the client asks questions. Option C, the client hears thumping sounds. Option D, the client wears a watch and wedding band. The correct answer is option D, the client wears a watch and wedding band. MRI uses a high-powered magnet. Metal objects like watches or wedding bands can be pulled toward the magnet or cause thermal burns. Question 103. Which of the following teaching points about preventing osteoporosis is correct? Here are the options. Option A, obtain an X-ray every 3 years to detect loss. Option B, avoid strenuous exercise. Option C, the RDA of calcium may be found in a wide variety of foods. Option D, RDA of calcium requires taking a supplement. The correct answer is option C. The RDA of calcium may be found in a wide variety of foods. Calcium is widely available in dairy, green leafy vegetables, and fortified foods. Dietary intake is the preferred method of prevention. Question 104. Before Jacob undergoes arthroscopy, which finding is a contraindication for this procedure? Here are the options. Option A, joint pain. Option B, joint deformity. Option C, joint flexion of less than 50%. Option D, joint stiffness. The correct answer is option C, joint flexion of less than 50%. Arthroscopy requires the joint to be maneuverable. If the client cannot flex the joint to at least 50%, the scope cannot be safely inserted. Question 105. During a routine checkup, Nurse Marion assesses a male client with acquired immunodeficiency syndrome AIDS for signs and symptoms of cancer. What is the most common AIDS-related cancer? Here are the options. Option A, squamous cell carcinoma. Option B, multiple myeloma. Option C, leukemia. Option D, Kaposi's sarcoma. The correct answer is option D, Kaposi's sarcoma. Kaposi's sarcoma is the most frequent malignancy associated with AIDS, presenting as purple or brown skin lesions caused by human herpesvirus 8. Question 106. Ricardo is scheduled for a prostatectomy, and the anesthesiologist plans to use a spinal subarachnoid block during surgery. Why does the client require special positioning for this type of anesthesia? Here are the options. Option A, to prevent confusion. Option B, to prevent seizures. Option C, to prevent cerebrospinal fluid CSF leakage. Option D, to prevent cardiac arrhythmias. The correct answer is option C, to prevent cerebrospinal fluid CSF leakage. Proper positioning and remaining supine post-procedure are necessary to prevent CSF leakage through the dural puncture, which can result in a severe spinal headache. Question 107. A male client had an nephrectomy 2 days ago and is now complaining of abdominal pressure and nausea. The first nursing action should be to. Here are the options. Option A, auscultate bowel sounds. Option B, palpate the abdomen. Option C, change the client's position. Option D, insert a rectal tube. The correct answer is option A, auscultate bowel sounds. Postoperative abdominal pressure and nausea may indicate paralytic ileus. Auscultating for bowel sounds is the first assessment step to evaluate gastrointestinal motility. Question 108. Wilfredo with a recent history of rectal bleeding is being prepared for a colonoscopy. How should the nurse Patricia position the client for this test initially? Here are the options. Option A, lying on the right side with legs straight. Option B, lying on the left side with knees bent. Option C, prone with the torso elevated. Option D, bent over with hands touching the floor. The correct answer is option B, lying on the left side with knees bent. The left side lying Sims position is used initially for colonoscopy because it follows the natural anatomy of the sigmoid colon, easing the insertion of the scope. Question 109. A male client with inflammatory bowel disease undergoes an ileostomy. On the first day after surgery, the client's stoma appears dusky. How should the nurse interpret this finding? Here are the options. Option A, blood supply to the stoma has been interrupted. Option B, this is a normal finding 1 day after surgery. Option C, the ostomy bag should be adjusted. Option D, an intestinal obstruction has occurred. The correct answer is option A, blood supply to the stoma has been interrupted. A dusky, pale, or purple stoma indicates impaired tissue perfusion or ischemia and is a surgical emergency that must be reported immediately. Question 110. Anthony suffers burns on the legs. Which nursing intervention helps prevent contractures? Here are the options. Option A, applying knee splints. Option B, elevating the foot of the bed. Option C, hyperextending the client's palms. Option D, performing shoulder range of motion exercises. The correct answer is option A. Applying knee splints. Splinting joints in a functional or extended position helps prevent the shortening of skin and connective tissue contractures during the healing process. Question 111. Nurse Ron is assessing a client with second and third degree burns on the face, arms, and chest. Which finding indicates a potential problem? Here are the options. Option A. Partial pressure of arterial oxygen PaO2 value of 80 mmHg. Option B. Urine output of 20 ml/hour. Option C. White pulmonary secretions. Option D. Rectal temperature of 100.6 degrees F 38 degrees C. The correct answer is option B. Urine output of 20 ml/hour. Normal urine output should be at least 30 ml/hr. An output of 20 ml/hr in a burn patient suggests inadequate fluid resuscitation or impending acute kidney injury. Question 112. Mr. Mendoza has suffered a cerebrovascular accident CVA and is too weak to move. To help the client avoid pressure ulcers, Nurse Celia should. Here are the options. Option A. Turn him frequently. Option B. Perform passive range of motion ROM exercises. Option C. Reduce the client's fluid intake. Option D. Encourage the client to use a footboard. The correct answer is option A. Turn him frequently. Repositioning the patient at least every 2 hours is the most effective nursing intervention to relieve pressure and prevent skin breakdown. Question 113. Nurse Maria plans to administer dexamethasone cream to a client who has dermatitis over the anterior chest. How should the nurse apply this topical agent? Here are the options. Option A. With a circular motion to enhance absorption. Option B. With an upward motion to increase blood supply. Option C. In long, even, outward and downward strokes in the direction of hair growth. Option D. In long, even, outward and upward strokes opposite the direction of hair growth. The correct answer is option C. In long, even, outward and downward strokes in the direction of hair growth. Applying topical medications in the direction of hair growth helps prevent irritation of the follicles, folliculitis, and ensures even distribution. Question 114. Which class of medication protects the ischemic myocardium by blocking catecholamines and sympathetic nerve stimulation? Here are the options. Option A. Beta-adrenergic blockers. Option B. Calcium channel blocker. Option C. Narcotics. Option D. Nitrates. The correct answer is option A. Beta-adrenergic blockers. Beta blockers block the effects of catecholamines like adrenaline, decreasing heart rate and myocardial oxygen demand, which protects the heart after an MI. Question 115. A male client has jugular distension. In what position should the nurse place the head of the bed to obtain the most accurate reading of jugular vein distension? Here are the options. Option A. High Fowler's. Option B. Raised 10 degrees. Option C. Raised 30 degrees. Option D. Supine position. The correct answer is option C. Raised 30 degrees. Jugular venous distension JVD is most accurately assessed with the head of the bed elevated at a 30 to 45 degree angle. Question 116. Which class of medications maximizes cardiac performance in clients with heart failure by increasing ventricular contractility? Here are the options. Option A. Beta-adrenergic blockers. Option B. Calcium channel blocker. Option C. Diuretics. Option D. Inotropic agents. The correct answer is option D. Inotropic agents. Positive inotropic agents such as digoxin increase the strength of the heart's contractions, thereby improving cardiac output in heart failure patients. Question 117. A male client has reduced HDL and elevated LDL levels. Which of the following dietary modifications is not appropriate for this client? Here are the options. Option A. Fiber intake of 25 to 30 g daily. Option B. Less than 30% of calories from fat. Option C. Cholesterol intake of less than 300 mg daily. Option D. Less than 10% of calories from saturated fat. The correct answer is option C. Cholesterol intake of less than 300 mg daily. For clients with high-risk lipid profiles, dietary cholesterol should be limited to less than 200 mg daily. 300 mg is the limit for the general healthy population. Question 118. A 37-year-old male was admitted with acute MI. Which of the following actions would breach the client's confidentiality? Here are the options. Option A. Verbal report to the telemetry nurse before transfer. Option B. Notifying the on-call physician about a change in condition. Option C. ED nurse checks the latest ECG results to check the client's progress. Option D. At the client's request, the nurse updates the client's wife. The correct answer is option C. ED nurse checks the latest ECG results to check the client's progress. Hospital staff who are not currently assigned to the patient's care have no legal right to access the patient's medical records or test results. Question 119. During a pause in compressions, the cardiac monitor shows narrow QRS complexes and HR of 70 with a palpable pulse. Which action should the nurse take first? Here are the options. Option A. Start an IV line and administer amiodarone. Option B. Check endotracheal tube placement. Option C. Obtain an arterial blood gas ABG sample. Option D. Administer atropine 1 mg/L-V. The correct answer is option B. Check endotracheal tube placement. When a pulse returns ROSC during advanced life support, confirming a patent and correctly placed airway ET tube is the first priority for stabilizing the patient. Question 120. Alvin with a massive pulmonary embolism will have an ABG performed. The acid-base disorder that may be present is? Here are the options. Option A. Metabolic acidosis. Option B. Metabolic alkalosis. Option C. Respiratory acidosis. Option D. Respiratory alkalosis. The correct answer is option D. Respiratory alkalosis. A pulmonary embolism causes hypoxia, which leads to hyperventilation. The excessive loss of CO2 results in respiratory alkalosis. Question 121. Armand is admitted with a pneumothorax and a chest tube is inserted. Bubbling appears in the water-sealed chamber. Which is the most likely cause? Here are the options. Option A. Air leak. Option B. Adequate suction. Option C. Inadequate suction. Option D. Kink chest tube. The correct answer is option A. Air leak. Continuous bubbling in the water seal chamber indicates an air leak, either in the patient's pleural space or within the drainage system itself. Question 122. Postoperative client receives 3,000 ml of Ringer's lactate over 24 hours. The drop factor is 10. How many drops per minute? Here are the options. Option A, 18. Option B, 21. Option C, 35. Option D, 40. The correct answer is option B, 21. Calculation. 3,000 ml x 10 GTT 24 hours x 60 min equals 30,000 1,004 by 40 equals 20.83, which rounds to 21 drops per minute. Question 123. Mickey is ordered Digoxin Lanaxin 0.12 mg. The bottle contains 0.05 mg in 1 ml. What amount should the nurse administer? Here are the options. Option A, 1.2 ml. Option B, 2.4 ml. Option C, 3.5 ml. Option D, 4.2 ml. The correct answer is option B, 2.4 ml. Calculation. 0.12 mg/0.05 mg/ml equals 2.4 ml. Question 124. Nurse Alexander teaches a client about elastic stockings. Which statement indicates the teaching was successful? Here are the options. Option A. I will wear the stockings until the physician tells me to remove them. Option B. I should wear the stockings even when I am asleep. Option C. Every 4 hours I should remove the stockings for a half hour. Option D. I should put on the stockings before getting out of bed in the morning. The correct answer is option D. I should put on the stockings before getting out of bed in the morning. Elastic TD stockings should be applied before the client gets out of bed, while the veins are less congested and the legs are least swollen. Question 125. The primary reason for rapid continuous rewarming of the area affected by frostbite is to. Here are the options. Option A. Lessen the amount of cellular damage. Option B. Prevent the formation of blisters. Option C. Promote movement. Option D. Prevent pain and discomfort. The correct answer is option A. Lessen the amount of cellular damage. Rapid rewarming in water 104-108 degrees F helps to quickly restore blood flow and stop the freezing process, which minimizes cellular death and tissue loss. Question 126. A client asks how hemodialysis will take the place of his kidneys. Hemodialysis works by. Here are the options. Option A. Passing water through a dialyzing membrane. Option B. Eliminating plasma proteins from the blood. Option C. Lowering the pH by removing non-volatile acids. Option D. Filtering waste through a dialyzing membrane. The correct answer is option D. Filtering waste through a dialyzing membrane. Hemodialysis uses the principle of diffusion to move nitrogenous waste products and excess electrolytes from the blood across a semi-permeable membrane. Question 127. A client with AIDS tells the nurse that he has been exposed to measles. Which action by the nurse is most appropriate? Here are the options. Option A. Administer an antibiotic. Option B. Contact the physician for an order for immune globulin. Option C. Administer an antiviral. Option D. Tell the client that he should remain in isolation for 2 weeks. The correct answer is option B. Contact the physician for an order for immune globulin. Immune globulin provides passive immunity and can prevent or modify measles in an immunocompromised person if given shortly after exposure. Question 128. A client with MRSA is on contact precautions. Which statement is true regarding these precautions? Here are the options. Option A. The client should be placed in a room with negative pressure. Option B. The door may remain open. Option C. The client should wear a mask at all times. Option D. Infection is prevented by hand washing, gloves, and a gown. The correct answer is option D. Infection is prevented by hand washing, gloves, and a gown. Contact precautions are designed to prevent transmission by direct or indirect contact. Required PPE includes gloves and a gown when entering the room. Question 129. A client with an above-the-knee amputation tells the nurse that his foot hurts and itches. Which response indicates an understanding? Here are the options. Option A. The pain will go away in a few days. Option B. The pain is due to peripheral nervous system interruptions. I will get you some pain medication. Option C. The pain is psychological. Option D. The pain and itching are due to infection. The correct answer is option B. The pain is due to peripheral nervous system interruptions. I will get you some pain medication. Phantom limb sensation is a real physical sensation caused by nerve endings in the stump sending signals to the brain. It requires pharmacological management. Question 130. A client with cancer of the pancreas has undergone a Whipple procedure. During this procedure, the doctor removes the... Here are the options. Option A. Head of the pancreas. Option B. Proximal third section of the small intestines. Option C. Stomach and duodenum. Option D. Esophagus and jejunum. The correct answer is option A. Head of the pancreas. The Whipple procedure pancreatic duodenectomy involves the removal of the head of the pancreas, the duodenum, part of the jejunum, and the gallbladder. Question 131. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should avoid. Here are the options. Option A. Packed fruits. Option B. Salt. Option C. Fresh raw pepper. Option D. Ketchup. The correct answer is option C. Fresh raw pepper. Neutropenic patients should avoid raw produce and certain spices like fresh pepper, as they can harbor high levels of bacteria and mold. Question 132. A client is discharged home with a prescription for Coumadin sodium warfarin. The client should be instructed to... Here are the options. Option A. Have a protime done monthly. Option B. Eat more fruits and vegetables. Option C. Drink more liquids. Option D. Avoid crowds. The correct answer is option A. Have a protime done monthly. Patients on warfarin must have their prothrombin time patient or international normalized ratio INR checked regularly to ensure the dosage is therapeutic. Question 133. The nurse is assisting with the removal of a central venous catheter. To facilitate removal, the nurse should instruct the client to. Here are the options. Option A. Perform the Valsalva maneuver as the catheter is advanced. Option B. Turn his head to the left side and hyperextend the neck. Option C. Take slow, deep breaths as the catheter is removed. Option D. Turn his head to the right while maintaining a sniffing position. The correct answer is option A. Perform the Valsalva maneuver as the catheter is advanced. The Valsalva maneuver increases intrathoracic pressure, which prevents air from entering the central circulation air embolism as the catheter is withdrawn. Question 134. Before administering streptokinase, the nurse should assess the client for. Here are the options. Option A. A history of streptococcal infections. Option B. Allergies to pineapples and bananas. Option C. Prior therapy with phenytoin. Option D. A history of alcohol abuse. The correct answer is option A. A history of streptococcal infections. Streptokinase is derived from streptococci. A recent strep infection can result in high antibody titers that may neutralize the drug or cause an allergic reaction. Question 135. A 43-year-old African American male is admitted with sickle cell anemia. Which of the following outcome criteria would the nurse use to assess circulation in the lower extremities? Here are the options. Option A. Body temperature of 99 degrees F or less. Option B. Toes moved in active range of motion. Option C. Sensation reported when soles of feet are touched. Option D. Capillary refill of 3 seconds. The correct answer is option D. Capillary refill of 3 seconds. Capillary refill is a direct assessment of peripheral tissue perfusion. In sickle cell anemia, vaso-occlusive crises can impair circulation, making refill time a critical metric. Question 136. A 30-year-old male is brought to the emergency department in sickle cell crisis. What is the best position for this client? Here are the options. Option A. Side lying with knees flexed. Option B. Knee chest. Option C. High Fowlers with knees flexed. Option D. Semi-Fowlers with legs extended on the bed. The correct answer is option D. Semi-Fowlers with legs extended on the bed. Flexing the knees or hips during a sickle cell crisis can further impede already compromised blood flow. Keeping the legs extended helps maximize circulation. Question 137. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of the highest priority? Here are the options. Option A. Taking hourly blood pressures with mechanical cuff. Option B. Encouraging fluid intake of at least 200 ml per hour. Option C. Position in high Fowlers with knee gatch raised. Option D. Administering Tylenol as ordered. The correct answer is option B. Encouraging fluid intake of at least 200 ml per hour. Hydration is the primary intervention for sickle cell crisis to reduce blood viscosity and prevent further sickling of red blood cells. Question 138. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat to assist with recovery? Here are the options. Option A. Peaches. Option B. Cottage cheese. Option C. popsicle. Option D, lima beans. The correct answer is option C, popsicle. Popsicles provide both comfort and much-needed hydration, which is essential for a patient in a vaso-occlusive crisis. Question 139. A client is complaining of severe pain in his feet and hands during a sickle cell crisis. The pulse oximetry is 92. Which intervention would be implemented first? Here are the options. Option A, adjust the room temperature. Option B, give a bolus of Roman 4 fluids. Option C, start O2. Option D, administer meperidine demerol 75 mg Roman 4 push. The correct answer is option C, start O2. Oxygenation is the priority ABC when the pulse oximeter shows hypoxia 92% and the patient is experiencing sickling, which is triggered by low oxygen. Question 140. The nurse is instructing a client with iron deficiency anemia on dietary choices. Which meal plan would the nurse expect the client to select? Here are the options. Option A, roast beef, gelatin salad, green beans, and peach pie. Option B, chicken salad sandwich, coleslaw, French fries, ice cream. Option C, egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. Option D, pork chop, creamed potatoes, corn, and coconut cake. The correct answer is option A, roast beef, gelatin salad, green beans, and peach pie. Roast beef is a high source of heme iron, which is absorbed more efficiently by the body than non-heme sources. Question 141. The nurse is recommending activities for a client with sickle cell anemia to avoid hypoxia. Which activity is most appropriate? Here are the options. Option A, a family vacation in the Rocky Mountains. Option B, chaperoning the local boys' club on a snow skiing trip. Option C, traveling by airplane for business trips. Option D, a bus trip to the Museum of Natural History. The correct answer is option D, a bus trip to the Museum of Natural History. High altitudes, mountains, plains, and extreme cold skiing can trigger a crisis. A low altitude, indoor bus trip is the safest choice. Question 142. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which of the following would the nurse include in the physical assessment? Here are the options. Option A, palpate the spleen. Option B, take the blood pressure. Option C, examine the feet for petechiae. Option D, examine the tongue. The correct answer is option D, examine the tongue. Vitamin B12 deficiency pernicious anemia is often characterized by a smooth, beefy red tongue known as glossitis. Question 143. An African American female is suspected of having vitamin B12 deficiency anemia. What body part would be the best indicator for jaundice? Here are the options. Option A, conjunctive of the eye. Option B, soles of the feet. Option C, roof of the mouth. Option D, shins. The correct answer is option C, roof of the mouth. The hard palate roof of the mouth is one of the most reliable sites to assess for jaundice in individuals with dark skin. Question 144. The nurse is conducting a physical assessment on a client with anemia. Which clinical manifestation would be most indicative of the anemia? Here are the options. Option A, BP 146/88. Option B, respirations 28 shallow. Option C, weight gain of 10 pounds in 6 months. Option D, pink complexion. The correct answer is option B, respirations 28 shallow. Tachypnea, increased respiratory rate, is a compensatory mechanism used by the body to increase oxygen intake when hemoglobin is low. Question 145. The nurse is teaching a client with polycythemia vera about complication prevention. Which statement by the client indicates a need for further teaching? Here are the options. Option A, I will drink 500 ml of fluid or less each day. Option B, I will wear support hose when I am up. Option C, I will use an electric razor for shaving. Option D, I will eat foods low in iron. The correct answer is option A, I will drink 500 ml of fluid or less each day. Clients with polycythemia vera should stay well hydrated, usually 3 liters/day, to decrease blood viscosity and prevent clot formation. Question 146. A 33-year-old male is being evaluated for possible acute leukemia. Which of the following would the nurse inquire about as part of the assessment? Here are the options. Option A, the client collects stamps as a hobby. Option B, the client recently lost his job as a postal worker. Option C, the client had radiation for treatment of Hodgkin's disease as a teenager. Option D, the client's brother had leukemia as a child. The correct answer is option C. The client had radiation for treatment of Hodgkin's disease as a teenager. Previous exposure to radiation or chemotherapy for other cancers like Hodgkin's significantly increases the risk of developing acute leukemia later in life. Question 147. An African American client is admitted with acute leukemia. What is the best site for examining for the presence of petechiae? Here are the options. Option A, the abdomen. Option B, the thorax. Option C, the earlobes. Option D, the soles of the feet. The correct answer is option D, the soles of the feet. In dark-skinned clients, petechiae are most easily observed in lighter areas such as the palms of the hands or the soles of the feet. Question 148. A client with acute leukemia is admitted to the oncology unit. Which of the following would be most important for the nurse to inquire? Here are the options. Option A, have you noticed a change in sleeping habits recently? Option B, have you had a respiratory infection in the last 6 months? Option C, have you lost weight recently? Option D, have you noticed changes in your alertness? The correct answer is option B. Have you had a respiratory infection in the last 6 months? Infection is a major cause of death in leukemia patients due to neutropenia. A history of recent infections can indicate a compromised immune system. Question 149. Which of the following would be the priority nursing diagnosis for the adult client with acute leukemia? Here are the options. Option A, oral mucous membrane, altered related to chemotherapy. Option B, risk for injury related to thrombocytopenia. Option C, fatigue related to the disease process. Option D, interrupted family processes. The correct answer is option B. Risk for injury related to thrombocytopenia. Thrombocytopenia puts the patient at extreme risk for spontaneous and life-threatening hemorrhage. Preventing injury and bleeding is the priority. Question 150. After the physician performs an amiotomy, the nurse's first action should be to assess the. Here are the options. Option A. Degree of cervical dilation. Option B. Fetal heart tones. Option C. Client's vital signs. Option D. Client's level of discomfort. The correct answer is option B. Fetal heart tones. The priority after the membrane's rupture amiotomy is assessing fetal heart tones to ensure the umbilical cord hasn't prolapsed. Question 151. A vaginal exam determines that the client's cervix is 5 cm dilated with 75% effacement. The client is in which phase of labor? Here are the options. Option A. Active. Option B. Latent. Option C. Transition. Option D. Early. The correct answer is option A. Active. The active phase of the first stage of labor is typically defined by cervical dilation between 4 and 7 cm. Question 152. A newborn with narcotic abstinence syndrome is admitted. Nursing care of the newborn should include. Here are the options. Option A. Teaching the mother to provide tactile stimulation. Option B. Wrapping the newborn snugly in a blanket. Option C. Placing the newborn in the infant seat. Option D. Initiating an early infant stimulation program. The correct answer is option B. Wrapping the newborn snugly in a blanket. Newborns experiencing withdrawal should be kept in a low-stimulation environment. Swaddling snugly helps provide comfort and reduces irritability. Question 153. Following the initiation of epidural anesthesia, the nurse should give priority to. Here are the options. Option A. Checking for cervical dilation. Option B. Placing the client in a supine position. Option C. Checking the client's blood pressure. Option D. Obtaining a fetal heart rate. The correct answer is option C. Checking the client's blood pressure. Maternal hypotension is a common side effect of epidural anesthesia, which can lead to decreased placental perfusion. Question 154. The nurse is aware that the best way to prevent postoperative wound infection in the surgical client is to. Here are the options. Option A. Administer a prescribed antibiotic. Option B. Wash your hands for 2 minutes before care. Option C. Wear a mask when providing care. Option D. Ask the client to cover her mouth when she coughs. The correct answer is option B. Wash your hands for 2 minutes before care. Hand hygiene is the single most effective method for preventing the spread of infection and protecting surgical wounds. Question 155. The elderly client is admitted to the emergency room with a suspected fractured hip. Which symptom is the client most likely to exhibit? Here are the options. Option A. Pain. Option B. Misalignment. Option C. Cool extremity. Option D. Absence of pedal pulses. The correct answer is option B. Misalignment. A classic sign of a hip fracture is the shortening and external rotation of the affected leg misalignment. Question 156. The nurse knows that a 60-year-old female client's susceptibility to osteoporosis is most likely related to. Here are the options. Option A. Lack of exercise. Option B. Hormonal disturbances. Option C. Lack of calcium. Option D. Genetic predisposition. The correct answer is option B. Hormonal disturbances. The decrease in estrogen production following menopause is the leading cause of bone density loss in postmenopausal women. Question 157. A 2-year-old is in Bryant's traction for a fractured femur. Which finding indicates the traction is working properly? Here are the options. Option A. The infant no longer complains of pain. Option B. The buttocks are 15 degrees off the bed. Option C. The legs are suspended in the traction. Option D. The pins are secured within the pulley. The correct answer is option B. The buttocks are 15 degrees off the bed. In Bryant's traction, the buttocks must be slightly elevated off the mattress to provide the necessary countertraction. Question 158. Which statement is true regarding balanced skeletal traction? Here are the options. Option A. Utilizes a stymon pin. Option B. Requires that both legs be secured. Option C. Utilizes Kirschner wires. Option D. Is used primarily to heal the fractured hips. The correct answer is option A. Utilizes a stymon pin. Skeletal traction involves the use of pins like stymon pins or wires inserted directly into the bone for long-term immobilization. Question 159. Immediately following surgery for an open reduction internal fixation of a fractured hip, the nurse should give priority to assessing. Here are the options. Option A. Serum collection Davol drain. Option B. Client's pain. Option C. Nutritional status. Option D. Immobilizer. The correct answer is option A. Serum collection Davol drain. Monitoring for excessive drainage or hemorrhage from the surgical site is the immediate post-operative priority. Question 160. Which statement by a family member indicates an understanding of the nurse's teaching regarding a percutaneous gastrostomy tube? Here are the options. Option A. I must flush the tube with water after feedings and clamp the tube. Option B. I must check placement 4 times per day. Option C. I will report to the doctor any signs of indigestion. Option D. If my father is unable to swallow, I will discontinue the feeding. The correct answer is option A. I must flush the tube with water after feedings and clamp the tube. Flushing the tube after feeding prevents clogging, and clamping the tube prevents the backflow of gastric contents. Question 161. A client is 2 hours post-total knee replacement. Which information requires notification of the doctor? Here are the options. Option A. Bleeding on the dressing is 3 cm in diameter. Option B. The client has a temperature of 100.6 degrees F 38.1 degrees C. Option C. The client's hematocrit is 26%. Option D. The urinary output has been 60 during the last 2 hours. The correct answer is option C. The client's hematocrit is 26%. A hematocrit of 26% is significantly low, suggesting substantial blood loss during or after surgery that may require a transfusion. Question 162. The nurse is caring for a client with a 5-year-old diagnosis of plumbism. Which history is most likely related? Here are the options. Option A. The client has traveled out of the country in the last 6 months. Option B. The client's parents are skilled stained glass artists. Option C. The client lives in a house built in the 1970s. Option D. The client has several brothers and sisters. The correct answer is option B. The client's parents are skilled stained glass artists. Lead plumbism is used in the soldering process of stained glass. If parents are artists, the child may have been exposed to lead dust or fumes. Question 163. Which equipment would assist the client with a total hip replacement with activities of daily living? Here are the options. Option A. High-seat commode. Option B. Recliner. Option C. TENS unit. Option D. Abduction pillow. The correct answer is option A. High-seat commode. A high-seat commode prevents the hip from flexing more than 90 degrees, which is a critical precaution to prevent prosthesis dislocation. Question 164. In anticipation of complications from anesthesia and narcotics in an elderly surgical client, the nurse should. Here are the options. Option A. Administer oxygen via nasal cannula. Option B. Have Narcan naloxone available. Option C. Prepare to administer blood products. Option D. Prepare to do cardioresuscitation. The correct answer is option B. Have Narcan naloxone available. Elderly patients are at higher risk for respiratory depression from narcotics. Naloxone Narcan should be readily available as an antidote. Question 165. A client with a history of abusing barbiturates abruptly stops taking the medication. The nurse should give priority to assessing the client for. Here are the options. Option A. Depression and suicidal ideation. Option B. Tachycardia and diarrhea. Option C. Muscle cramping and abdominal pain. Option D. Tachycardia and euphoric mood. The correct answer is option C. Muscle cramping and abdominal pain. Withdrawal from barbiturates is life-threatening and characterized by severe physical symptoms including muscle spasms, tremors, and abdominal pain. Question 166. During the assessment of a laboring client, the nurse notes that the FHT are loudest in the upper right quadrant. The infant is most likely in which position? Here are the options. Option A. Right breech presentation. Option B. Right occiput anterior presentation. Option C. Left sacral anterior presentation. Option D. Left occiput transverse presentation. The correct answer is option A. Right breech presentation. Fetal heart tones heard in the upper quadrants of the abdomen usually indicate a breech presentation. Question 167. The primary physiological alteration in the development of asthma is. Here are the options. Option A. Bronchial inflammation and dyspnea. Option B. Hypersecretion of abnormally viscous mucus. Option C. Infectious processes causing mucosal edema. Option D. Spasm of bronchial smooth muscle. The correct answer is option D. Spasm of bronchial smooth muscle. While asthma is a chronic inflammatory disease, The acute clinical manifestation is primarily caused by the spasm of bronchial smooth muscle bronchospasm. Question 168. A client with mania is unable to finish her dinner. To help her maintain sufficient nourishment, the nurse should. Here are the options. Option A. Serve high-calorie food she can carry with her. Option B. Encourage her appetite with favorite foods. Option C. Serve her small, attractively arranged portions. Option D. Allow her in the unit kitchen for extra food. The correct answer is option A. Serve high-calorie food she can carry with her. Clients in a manic state are often too hyperactive to sit for meals. Providing high-calorie finger foods allows them to eat while on the move. Question 169. To maintain Bryant's traction, the nurse must make certain that the child's. Here are the options. Option A. Hips are resting on the bed. Option B. Hips are slightly elevated above the bed. Option C. Hips are elevated on a pillow. Option D. Hips and legs are flat on the bed. The correct answer is option B. Hips are slightly elevated above the bed. In Bryant's traction, the child's buttocks should be slightly elevated off the mattress to provide the necessary countertraction. Question 170. Which action by the nurse indicates understanding of the care for a client with herpes zoster? Here are the options. Option A. The nurse covers the lesions with a sterile dressing. Option B. The nurse wears gloves when providing care. Option C. The nurse administers a prescribed antibiotic. Option D. The nurse administers oxygen. The correct answer is option B. The nurse wears gloves when providing care. Herpes zoster shingles is transmissible through direct contact with the lesions. Therefore, gloves must be worn during care. Question 171. A trough level is ordered for a client receiving vancomycin. The nurse should have the blood collected. Here are the options. Option A. 15 minutes after the infusion. Option B. 30 minutes before the infusion. Option C. 1 hour after the infusion. Option D. 2 hours after the infusion. The correct answer is option B. 30 minutes before the infusion. Trough levels are drawn when the medication is at its lowest concentration in the bloodstream, which is typically 30 minutes before the next dose. Question 172. The client using a diaphragm should be instructed to. Here are the options. Option A. Refrain from keeping it in longer than 4 hours. Option B. Keep the diaphragm in a cool location. Option C. Have it resized if she gains 5 pounds. Option D. Have it resized if she has any surgery. The correct answer is option B. Keep the diaphragm in a cool location. Diaphragms should be stored in a cool, dry place to prevent the degradation of the rubber or silicone. Question 173. Which statement by a mother planning to breastfeed indicates the need for additional teaching? Here are the options. Option A. I'm wearing a support bra. Option B. I'm expressing milk from my breast. Option C. I'm drinking 4 glasses of fluid during a 24-hour period. Option D. I'll allow the water to run over my breasts in the shower. The correct answer is option C. I'm drinking 4 glasses of fluid during a 24-hour period. Breastfeeding mothers require significantly more hydration, typically 8 to 10 glasses of fluid per day, to maintain adequate milk production. Question 174. Damage to the Roman 7 cranial nerve results in. Here are the options. Option A. Facial pain. Option B. Absence of ability to smell. Option C. Absence of eye movement. Option D. Tinnitus. The correct answer is option A. Facial pain. Damage to the Roman 7 cranial nerve facial affects facial expression and taste. However, it is frequently confused with the V nerve trigeminal, which causes facial pain. Question 175. A client is receiving pyridium for a urinary tract infection. The client should be taught that the medication may. Here are the options. Option A. Cause diarrhea. Option B. Change the color of her urine. Option C. Cause mental confusion. Option D. Cause changes in taste. The correct answer is option B. Change the color of her urine. Phenazopyridine pyridium is a urinary analgesic that typically turns the urine a bright orange or red color. Question 176. Which of the following tests should be performed before beginning a prescription of accutane? Here are the options. Option A. Check the calcium level. Option B. Perform a pregnancy test. Option C. Monitor apical pulse. Option D. Obtain a creatinine level. The correct answer is option B. Perform a pregnancy test. Isotretinoin accutane is highly teratogenic. Female clients must have a negative pregnancy test before starting therapy and use strict contraception. Question 177. Which nursing intervention is most critical during the administration of acyclovir Zovirax? Here are the options. Option A. Limit the client's activity. Option B. Encourage a high-carbohydrate diet. Option C. Utilize an incentive spirometer. Option D. Encourage fluids. The correct answer is option D. Encourage fluids. Acyclovir can cause renal damage due to crystal formation in the kidneys. Maintaining high fluid intake is essential to prevent nephrotoxicity. Question 178. A client is admitted for an MRI. The nurse should question the client regarding. Here are the options. Option A. Pregnancy. Option B. A titanium hip replacement. Option C. Allergies to antibiotics. Option D. Inability to move his feet. The correct answer is option A. Pregnancy. The nurse must verify the patient's pregnancy status and the presence of any ferromagnetic metal implants before an MRI. Question 179. The nurse is caring for a client receiving amphotericin B. Which finding indicates toxicity? Here are the options. Option A. Changes in vision. Option B. Nausea. Option C. Urinary frequency. Option D. Changes in skin color. The correct answer is option C. Urinary frequency. Amphotericin B is highly nephrotoxic. Changes in urinary output or frequency can indicate early renal impairment. Question 180. A patient with congestive heart failure complains of dyspnea. Which action is the first the nurse should perform? Here are the options. Option A. Ask the patient to lie down. Option B. Draw blood for ABD. Option C. Send the patient for a chest X-ray. Option D. Check blood pressure. The correct answer is option D. Check blood pressure. When a patient is in respiratory distress, the first priority is to assess vital signs to determine the patient's current clinical stability. Question 181. A patient prescribed nitroglycerin for angina complains of frequent headaches. Which response is correct? Here are the options. Option A. Stop taking the nitroglycerin. Option B. Go to the emergency department. Option C. Headaches are a frequent side effect because it causes vasodilation. Option D. The headaches are unlikely to be related. The correct answer is option C. Headaches are a frequent side effect because it causes vasodilation. Nitroglycerin is a potent vasodilator. Headache is the most common side effect due to the dilation of cerebral blood vessels. Question 182. A patient in remission from colon cancer complains of fatigue and difficulty with concentration. Which explanation accounts for this? Here are the options. Option A. The symptoms may be from anemia caused by chemotherapy. Option B. The patient may be immunosuppressed. Option C. The patient may be depressed. Option D. The patient may be dehydrated. The correct answer is option A. The symptoms may be from anemia caused by chemotherapy. Chemotherapy can cause lingering bone marrow suppression, leading to anemia which manifests as fatigue and chemobrain difficulty concentrating. Question 183. A clinic patient has a hemoglobin of 10.8 D/DL and is a strict vegetarian. Which advice is appropriate? Here are the options. Option A. The diet provides adequate iron. Option B. The patient should add meat to her diet. Option C. Use iron cookware and eat dark green, leafy vegetables. Option D. Add a cup of coffee or tea to every meal. The correct answer is option C. Use iron cookware and eat dark green, leafy vegetables. Vegetarians can obtain sufficient iron by consuming non-heme iron sources like legumes and leafy greens and using iron cookware. Question 184. Which is the most accurate statement regarding a PRBC transfusion? Here are the options. Option A. Reaction is most likely after infusion is complete. Option B. PRBC are best infused through a 20G catheter. Option C. PRBC should be flushed with 5% dextrose. Option D. A nurse should remain in the room during the first 15 minutes. The correct answer is option D. A nurse should remain in the room during the first 15 minutes. The first 15 minutes are the most critical for identifying life-threatening acute hemolytic reactions. Question 185. Which patient at triage should be assigned the highest priority? Here are the options. Option A. Patient with low-grade fever and myalgias. Option B. Patient unable to bear weight on the left foot. Option C. Patient with abdominal and chest pain after a spicy meal. Option D. Child with a 1-inch bleeding laceration on the chin. The correct answer is option C. Patient with abdominal and chest pain after a spicy meal. Chest pain must always be treated as a potential myocardial infarction until proven otherwise. making it the highest triage priority. Question 186. A patient has a calcium level of 6.0 mg/dl. Which symptom would you not expect to see? Here are the options. Option A. Numbness in hands and feet. Option B. Muscle cramping. Option C. Hypoactive bowel sounds. Option D. Positive CH Vostex sign. The correct answer is option C. Hypoactive bowel sounds. Hypocalcemia normal 8.5-10.5 causes neuromuscular irritability and hyperactive bowel sounds. Hypoactive sounds are seen in hypercalcemia. Question 187. A patient has an NG tube attached to low suction. Which ABD result might be expected? Here are the options. Option A pH 7.52, PCO2 54 mmHg. Option B pH 7.42, PCO2 40 mmHg. Option C pH 7.25, PCO2 25 mmHg. Option D pH 7.38, PCO2 36 mmHg. The correct answer is option A. pH 7.52, PCO2 54 mmHg. Loss of gastric acid via suctioning leads to metabolic alkalosis, elevated pH with a compensatory increase in PCO2. Question 188. A patient scheduled for surgery is taking a high dose of warfarin. The nurse anticipates which action? Here are the options. Option A. Draw blood for patient and INR level. Option B. Administer vitamin K. Option C. Draw blood for type N crossmatch. Option D. Cancel the surgery immediately. The correct answer is option A. Draw blood for patient and INR level. The surgeon needs to know the patient's current coagulation status patient/INR to determine if it is safe to proceed with the procedure. Question 189. Which of the following laboratory results are abnormal? Select all that apply. Here are the options. Option A. Hemoglobin 10.4 g/dl. Option B. Total cholesterol 340 mg/dl. Option C. Total serum protein 7.0 g/dl. Option D. A1C 5.4%. The correct answer is option B. Total cholesterol 340 mg/dl. A cholesterol level of 340 is significantly elevated, normal 200. Hemoglobin 10.4 is also low, normal 12-16. Question 190. Which statement about juvenile idiopathic arthritis is most accurate? Here are the options. Option A. Poor chance of recovery without deformity. Option B. Most progress to adult RA. Option C. Non-steroidal anti-inflammatory drugs are the first choice. Option D. Physical activity should be minimized. The correct answer is option C. Non-steroidal anti-inflammatory drugs are the first choice. NSAID are the primary first-line treatment to manage the inflammation and pain associated with juvenile idiopathic arthritis. Question 191. A child has a puncture wound and suspected osteomyelitis. Which action is done immediately before the antibiotic is started? Here are the options. Option A. The admission orders are written. Option B. A blood culture is drawn. Option C. A CBC with differential is drawn. Option D. The parents arrive. The correct answer is option B. A blood culture is drawn. Cultures must always be obtained before the first dose of antibiotics is administered to ensure accurate identification of the pathogen. Question 192. A 2-year-old child refuses to walk and has a swollen leg. Which does the nurse suspect? Here are the options. Option A. Possible fracture of the tibia. Option B. Bruising of the gastrocnemius. Option C. Possible fracture of the radius. Option D. No anatomic injury. The correct answer is option A. Possible fracture of the tibia. Swelling and refusal to bear weight in a toddler's leg are classic indicators of a toddler's fracture or tibial fracture. Question 193. Which information should the nurse provide to the parents of a child with cerebral palsy? Here are the options. Option A. Regular screening is important for secondary delays. Option B. CP is caused by injury to upper motor neurons. Option C. Milestones will require no intervention. Option D. Outdoor activities are prohibited. The correct answer is option B. CP is caused by injury to upper motor neurons. Cerebral palsy is a motor dysfunction disorder resulting from permanent, non-progressive damage to the upper motor neurons. Question 194. Which statement about Duchenne's muscular dystrophy is most accurate? Here are the options. Option A. Daughters have 50% chance as carriers, sons 50% chance of disease. Option B. Both have a 50% chance of developing the disease. Option C. Each child has a 25% chance of developing it. Option D. Sons only have a 25% chance of developing it. The correct answer is option A. Daughters have 50% chance as carriers, sons 50% chance of disease. Duchenne's is an X-linked recessive disorder. A carrier mother has a 50% chance of passing the affected X to her son's disease or daughter's carrier. Question 195. Mrs. Shua, a 78-year-old client, is admitted with the diagnosis of mild chronic heart failure. Which lung sound does the nurse expect to hear? Here are the options. Option A. Stridor. Option B. Crackles. Option C. Wheezes. Option D. Friction rubs. The correct answer is option B. Crackles. Crackles rails are the classic breath sound associated with heart failure, caused by fluid in the small airways and alveoli. Question 196. Patrick, hospitalized following a myocardial infarction, asks why he is taking morphine. The nurse explains that morphine. Here are the options. Option A. Decreases anxiety and restlessness. Option B. Prevents shock and relieves pain. Option C. Dilates coronary blood vessels. Option D. Helps prevent fibrillation. The correct answer is option B. Prevents shock and relieves pain. Morphine is the drug of choice in MI because it relieves severe pain, reduces anxiety, decreasing sympathetic workload, and reduces preload/afterload. Question 197. Which of the following should the nurse teach the client about the signs of digitalis toxicity? Here are the options. Option A. Increased appetite. Option B. Elevated blood pressure. Option C. Skin rash over the chest and back. Option D. Visual disturbances such as seeing yellow spots. The correct answer is option D. Visual disturbances such as seeing yellow spots. Digitalis digoxin toxicity commonly presents as gastrointestinal distress and visual changes, particularly yellow-green halos or spots. Question 198. Nurse Tricia teaches a client with heart failure to take oral furosemide in the morning. The reason for this is to help. Here are the options. Option A. Retard rapid drug absorption. Option B. Excrete excessive fluids accumulated at night. Option C. Prevent sleep disturbances during the night. Option D. Prevention of electrolyte imbalance. The correct answer is option C. Prevent sleep disturbances during the night. Taking diuretics in the morning prevents nocturia, frequent nighttime urination, which would otherwise disturb the client's sleep. Question 199. What would be the primary goal of therapy for a client with pulmonary edema and heart failure? Here are the options. Option A. Enhance comfort. Option B. Increase cardiac output. Option C. Improve respiratory status. Option D. Decrease peripheral edema. The correct answer is option B. Increase cardiac output. By increasing cardiac output, the heart pumps more effectively, which reduces the backup of fluid into the lungs, pulmonary edema. Question 200. Nurse Linda is monitoring a client with decerebrate posturing. Which of the following is a characteristic of this type of posturing? Here are the options. Option A. Upper extremity flexion with lower extremity flexion. Option B. Upper extremity flexion with lower extremity extension. Option C. Extension of the extremities after a stimulus. Option D. Flexion of the extremities after stimulus. The correct answer is option C. Extension of the extremities after stimulus. Decerebrate posturing involves the rigid extension of all four extremities and is usually a sign of severe brainstem injury. Question 201. Nurse Betty informs a client taking Cascara Sagrada that which of the following may be experienced as a side effect? Here are the options. Option A. GI bleeding. Option B. Peptic ulcer disease. Option C. Abdominal cramps. Option D. Partial bowel obstruction. The correct answer is option C. Abdominal cramps. Cascara Sagrada is a stimulant laxative that can cause significant abdominal cramping as it increases peristalsis. Question 202. Dr. Marquez orders a continuous Roman 4-nitroglycerin infusion for a client with MI. Which is the most essential nursing action? Here are the options. Option A. Monitoring urine output frequently. Option B. Monitoring blood pressure every 4 hours. Option C. Obtaining serum potassium levels daily. Option D. Obtaining an infusion pump for the medication. The correct answer is option D. Obtaining an infusion pump for the medication. Roman 4-nitroglycerin is a potent vasodilator and must be administered via a volumetric infusion pump to ensure precise dosing and prevent hypotension. Question 203. During the second day of hospitalization for MI, which of the following is an expected outcome? Here are the options. Option A. Able to perform self-care without pain. Option B. Severe chest pain. Option C. Can recognize the risk factors of MI. Option D. Can participate in cardiac rehab walking program. The correct answer is option C. Can recognize the risk factors of MI. By the second day, the patient should be hemodynamically stable and ready to begin education on lifestyle modifications and risk factor reduction. Question 204. A client is admitted with a right-sided brain attack. In caring for this client, the nurse should plan to. Here are the options. Option A. Apply elastic stockings. Option B. Use hand roll and extend the left upper extremity on a pillow. Option C. Use a bed cradle to prevent dorsiflexion. Option D. Do passive range of motion exercise. The correct answer is option B. Use hand roll and extend the left upper extremity on a pillow. Supporting the affected left side with hand rolls and pillows helps prevent contractures and maintains functional alignment. Question 205. A client has returned to the unit after a left nephrectomy. Which of the following is the highest priority? Here are the options. Option A. Hourly urine output. Option B. Temperature. Option C. Able to turn side to side. Option D. Able to sip clear liquid. The correct answer is option A. Hourly urine output. Monitoring hourly urine output is critical to ensure the remaining kidney is functioning adequately and to detect early signs of shock. Question 206. During precardiac catheterization teaching, Nurse Cherry should inform the client that the primary purpose of the procedure is. Here are the options. Option A. To determine the existence of CHD. Option B. To visualize the disease process in the coronary arteries. Option C. To obtain the heart chamber's pressure. Option D. To measure oxygen content. The correct answer is option B. To visualize the disease process in the coronary arteries. The primary diagnostic goal of cardiac catheterization is to visualize blockages or narrowing in the coronary arteries via angiography. Question 207. During the first several hours after a cardiac catheterization, it is essential for the nurse to. Here are the options. Option A. Elevate the client's bed at 45 degrees. Option B. Instruct the client to cough and deep breathe. Option C. Frequently monitor the client's apical pulse and blood pressure. Option D. Monitor temperature every hour. The correct answer is option C. Frequently monitor the client's apical pulse and blood pressure. Frequent vital signs and assessment of the insertion site for bleeding/hematoma and peripheral pulses are the priorities post-procedure. Question 208. Kate, who had mitral valve replacement, experiences continuous bleeding from the incision. Which agent should the nurse prepare? Here are the options. Option A. Protamine sulfate. Option B. Quinidine sulfate. Option C. Vitamin C. Option D. Coumadin. The correct answer is option A. Protamine sulfate. Protamine sulfate is the specific antidote used to reverse the effects of heparin, which is often used during cardiac surgery. Question 209. To promote good dental care in clients with endocarditis, the teaching plan should include the proper use of a. Here are the options. Option A. Dental floss. Option B. Electric toothbrush. Option C. Manual toothbrush. Option D. Irrigation device. The correct answer is option C. Manual toothbrush. A soft manual toothbrush is preferred. Devices like water picks or floss can cause gingival trauma and bleeding, leading to bacteremia. Question 210. After a long leg cast is removed, the male client should. Here are the options. Option A. Cleanse the leg by scrubbing with a brisk motion. Option B. Put leg through full range of motion twice daily. Option C. Report any discomfort or stiffness to the physician. Option D. Elevate the leg when sitting for long periods of time. The correct answer is option D. Elevate the leg when sitting for long periods of time. After cast removal, the limb is prone to edema due to the loss of support. Elevation helps manage swelling. Question 211. While performing a physical assessment of a client with gout, the nurse should assess for additional tophi. Here are the options. Option A. Buttocks. Option B. Ears. Option C. Face. Option D. Abdomen. The correct answer is option B. Ears. Tophi crystals commonly deposit in the outer ear pinna, as well as in the joints of the hands and feet. Question 212. Demonstration of crutch walking with a tripod gait was understood when the client places weight on the. Here are the options. Option A. Palms of the hands and axillary regions. Option B. Palms of the hand. Option C. Axillary regions. Option D. Feet, which are set apart. The correct answer is option B. Palms of the hand. In crutch walking, weight should be supported by the palms of the hands, never the axillae, to prevent brachial plexus nerve damage. Question 213. A client with RA states he only has no pain when lying still. During the convalescent stage, the nurse should encourage. Here are the options. Option A. Active joint flexion and extension. Option B. Continued immobility until pain subsides. Option C. Range of motion exercises twice daily. Option D. Flexion exercises 3 times daily. The correct answer is option C. Range of motion exercises twice daily. ROM exercises are essential to prevent joint ankylosis, permanent stiffening, and maintain as much function as possible. Question 214. Following spinal surgery, the nurse should perform which assessment? Here are the options. Option A. Observe the client's bowel movement and voiding patterns. Option B. Log roll the client to prone position. Option C. Assess the client's feet for sensation and circulation. Option D. Encourage client to drink plenty of fluids. The correct answer is option C. Assess the client's feet for sensation and circulation. Assessing neurovascular status, sensation, and circulation in the extremities is vital to ensure no spinal cord or nerve damage occurred. Question 215. During the diuretic phase of acute renal failure, the client must be assessed for signs of. Here are the options. Option A. Hypovolemia. Option B. Renal failure. Option C. Metabolic acidosis. Option D. Hyperkalemia. The correct answer is option A. Hypovolemia. In the diuretic phase, the kidneys can produce urine, but cannot concentrate it, leading to massive fluid loss and potential hypovolemic shock. Question 216. Which of the following tests differentiates mucus from cerebrospinal fluid CSF in nasal drainage? Here are the options. Option A, protein. Option B, specific gravity. Option C, glucose. Option D, microorganism. The correct answer is option C, glucose. CSF contains glucose, whereas normal nasal mucus does not. A simple bedside glucose test dextrosticks can help identify a CSF leak. Question 217. What is the primary cause of tonic-clonic seizures in adults older than 20 years? Here are the options. Option A, electrolyte imbalance. Option B, head trauma. Option C, epilepsy. Option D, congenital defect. The correct answer is option B, head trauma. While many factors exist, head trauma is a leading cause of acquired seizure disorders in the adult population. Question 218. What is the priority nursing assessment in the first 24 hours after admission of a client with a thrombotic CVA? Here are the options. Option A, pupil size and pupillary response. Option B, cholesterol level. Option C, echocardiogram. Option D, bowel sounds. The correct answer is option A, pupil size and pupillary response. Monitoring pupillary response is a key part of the neurological assessment to detect changes in intracranial pressure or worsening stroke status. Question 219. Which discharge instruction is most appropriate for a client with multiple sclerosis? Here are the options. Option A, practice using mechanical aids for future disabilities. Option B, follow health habits to change the disease course. Option C, keep active, use stress reduction, and avoid fatigue. Option D, accept a quiet and inactive lifestyle. The correct answer is option C, keep active, use stress reduction, and avoid fatigue. MS is characterized by exacerbations. Maintaining a balance of activity and rest while avoiding stress/fatigue helps prevent flare-ups. Question 220. What is the early indicator of hypoxia in the unconscious client? Here are the options. Option A, cyanosis. Option B, increased respirations. Option C, hypertension. Option D, restlessness. The correct answer is option D, restlessness. Restlessness and agitation are the earliest signs of hypoxia as the brain responds to decreasing oxygen levels. Question 221. A client is experiencing spinal shock. The nurse should expect the function of the bladder to be. Here are the options. Option A, normal. Option B, atonic. Option C, spastic. Option D, uncontrolled. The correct answer is option B, atonic. Spinal shock results in a temporary loss of all reflex activity below the injury, leading to an atonic flaccid bladder and urinary retention. Question 222. During which stage is the action of a carcinogen considered irreversible? Here are the options. Option A, progression stage. Option B, initiation stage. Option C, regression stage. Option D. Promotion stage. The correct answer is option A. Progression stage. The progression stage is characterized by increased growth rate, invasiveness, and metastases. At this point, the process is irreversible. Question 223. Among the following components of a thorough pain assessment, which is the most significant? Here are the options. Option A. Effect. Option B. Cause. Option C. Causing factors. Option D. Intensity. The correct answer is option D. Intensity. Pain is subjective. The client's self-report of pain intensity using a scale is the most significant component for directing treatment. Question 224. A 65-year-old female is experiencing a flare-up of pruritus. Which action could aggravate the condition? Here are the options. Option A. Sleeping in a humidified environment. Option B. Daily baths with fragrant soap. Option C. Using clothes made from 100% cotton. Option D. Increasing fluid intake. The correct answer is option B. Daily baths with fragrant soap. Fragrant soaps and frequent hot baths dry the skin and cause irritation, significantly worsening pruritus itching.